Well, good afternoon, everybody. I'm so glad you were able to join us today. We are excited to welcome back John Robinson, education consultant at the Hartford Group. John is going to walk us through managing employee leave under the Family and Medical Leave Act. If you have a question, please submit it in the chat, and if we don't get to it today, we will follow up with you. Your SHRM and HRCI credits will be awarded via email for those who are eligible, along with today's recording in the next day or two. John, the mic is yours.
All right. Well, thank you so much and excited to talk to everybody. Dina, thanks for the great introduction. We absolutely want to make sure today, when we're talking about FMLA, that everybody has a really good understanding about what it really means and why it's so important. And I definitely want to impress upon everyone these laws were not enacted to help the employer in any way. And the more that we resist, and I'm sorry, it was working fine a second ago and it's not anymore. But the more that you resist and the more that you try to say, hey, we're not going to provide you any coverage. Can you see that, Dina?
Yes, all good.
Okay. The more that you resist and restrict and try to deny coverage, there's going to be more opportunities for the employee to sue and to complain and to get the Department of Labor involved. So please remember, if you have an employee who is eligible, you need to be following up. And the goal is not to deny or restrict coverage in any way. Your goal needs to be, how can we help you stay at work or return to work as quickly and safely as possible? The next thing that I always say as well is you need an attorney. We are not your attorneys. Corporate Synergies is not your attorney. You need attorneys to help you to understand your programs, make sure they're consistent and compliant, make sure that they are dovetailing appropriately with state leave laws and local leave laws and ADA. So please make sure not having an attorney is a danger, and your attorney is there to assist you to better understand how your programs all go together. So today, we're going to talk about absence management. That's the really big picture, right? And then just really break it down and talk about FMLA and talk about all that state and local leave laws. And we'll dabble a little bit in ADA, and how that interplays with everything. And then absolutely talk about that cost of noncompliance and offer solutions to you. But I really want to make sure that we understand that. And I think if you've been on prior sessions, you've seen my pyramid of absence. Absence and leave management and ADA and workers' compensation and paid medical and family leave and state and local sick leave, all of this around employees not being at work. It's really important to understand how they all layer on top of each other, how they all have components that are the same, and how important it is for you as an employer when you're putting together these pieces that you understand your own disability programs and your own PTO sick vacation programs and you're offering employer sponsored leave programs. So, how all this works together is really important. And then also understanding that all that in the dark purple, the required by law, anything associated with the law, you already know. There's no way for you to be restricting that coverage in any way. If that employee is eligible, they are getting it. So making sure that you understand what needs to go into determining eligibility and how do we interact all these leaves together and what are the different pieces of compliance that you need to be working on and what are the communication requirements and how do we manage these What's the reporting requirements that are out there? And then what are we doing to document this, our process and procedure, and making sure it's in our handbooks? These are all important things. Don't push it to the side. It cannot be done off the side of a desk. Time and effort needs to be spent because the number one way that you're going to have some sort of legal or Department of Labor, which oversees FMLA, or the Equal Employment Opportunity Commission that oversees ADA and Pregnant Workers Fairness Act, the number one way that they're going to come and be looking is that you don't have things documented. You are not communicating. You are not letting people take leave. So those are the things that you need to understand. Take the time. The most important piece, of course, is FMLA. So understanding this is a federal coverage, family and medical leave, went into effect in 1993, applies to businesses with 50 or more employees. It is giving 12 weeks of unpaid job protected leave, bonding or caring for a new child, caring for a covered family member, your own serious health condition, military related leaves. Employee health benefits need to stay in effect, and the employee is returning to the same or equivalent position at the end of the leave. And I'm sure you're all sitting there thinking, "Hey, I know this, right? We've taken we understand that." But when's the last time you trained your front end leaders on that? What's your return to work policy? What does return to same or equivalent position mean? And do they understand what that means? What about your call-in process? I know I was working with an employer the other day, and they feel that everybody's taking advantage of their leave program. Well, they allow them to notify them of call-ins after 30 days. After 30 days. Oh, that was a call-in. Really? These are things, right? Understanding what the law allows and how things need to be done. Understanding that 12 weeks is 480 hours, is over 30,000 minutes. Understanding that it is unpaid, but you know what? There's pieces that, if it is paid, are not going to extend that 12 weeks, and you can require people to use PTO time. And understanding what is job protection. Understanding a covered family member, spouse, child, parent. Understanding what is a serious health condition. These are all things that we're going to talk about today, but when you break it down, this little blurb becomes a lot bigger. You need to take the time to understand that, and front end leaders need to understand this too, because they are impacted by it every single day. So,
I have a quick question.
sure.
Hi. I'm working with a company that's under 50,
Okay.
and our CEO unfortunately he's just been put on a leave due to a brain tumor. Um, he is using his PTO because in the handbook, they're permitted to use up their PTO while they're on a medical leave.
Hmm.
And this operation is in the state of Las Vegas, Nevada.
Okay.
Um, I'm working with ADP Total Source, but I'm still like not sure how the protection works when you're under 50. So I was hoping you could maybe touch on that.
Well, if it's under 50 in total, then you don't have to provide FMLA protection. So, but what does, a couple things here, and again, you're going to need an attorney, right?
Mhm.
So, these are things to think about, right? I'm not answering and saying emphatically it's this or that. Do we skirt the line of 50? Sometimes we're 55, sometimes we're 49.
No, we're in our 20s.
Okay. So that's always a concern. So clearly not near 50 in any way. So, and then the other thing, so FMLA doesn't apply. So there is no federal coverage, and you can't say it is, right? You can't say, well, we're going to give it to you anyways. You can't do that, right? But Does the company have some sort of employer sponsored leave that kind of mimics FMLA? Or is it just a discretionary leave policy? We give it when we can to who we want to, and that's it. So, what does the handbook say?
That we do participate in employer sponsor leave. I mean, we'll probably be at 50 employees within the next 6 months, but we're not there right now. And this all happened, popped
So
up.
I would definitely say if it's in the handbook that you have an employer sponsored leave that will provide FMLA like coverages, um, okay. So then you need to manage to what that employer sponsored leave is. So
Got it.
however long it is, but it is not FMLA.
Mhm.
Now, the only thing is when you do hit 50, and you say, okay, now we are FMLA, and there's things that have to happen there, right? That we can't, I don't have time to go over here, but that person might be able to get additional time once you become an FMLA eligible employer.
Hmm. Okay.
So things to think about.
Yep. Thank you.
You're welcome. So, we kind of talked about some of this stuff, but to be eligible, right? 50 employees and a 75-mile radius, and you're not a public sector employer. I will clarify that, correct? You're private. Whoever just answered that question, asked that question.
Correct.
Okay, private. Okay. Um, so for an employee, they have had to work for the employer a minimum of 12 months, but it does not need to be consecutive, and there's a 7-year look back period. So all those ski resorts and summer pools and golf courses that have the same people coming back year after year after year, guess what? They're going to become eligible. And then they've had to work 1,250 hours in the 12 months immediately preceding the leave. So, in those exact same places where they normally have people working 50, 60 hours a week, they're probably going to hit that 1,250 hours too. So, and the onus is on the employer. So, if you want to say no, you didn't, you better be able to prove it. So, the eligibility of the employee is very important. It is one of the only things that an employer has to manage the coverage. So make sure you're tracking that. Make sure you're notifying employees when they do become eligible. It's required. So you want to make sure you're doing everything you can. The employer has a lot of responsibilities when it comes to FMLA, posting notices, ensure all employees have access to that leave policy, right? It's updated, your handbook, you've looked at it, you've communicated it, you're providing timely notices. So rights and responsibilities notices need to go out within 5 days. That eligibility piece needs to be confirmed immediately. You need to designate leave timely. And if the employee is not eligible, you need to notify them why. And not in 30 days, in 5 days. So there's a lot on the employer to do things the right way. And then again, when we're talking about gathering premiums from people when they're not at work, how are we going to do that? Letting them know they need to, and that's the employee needs to pay, and returning them from work. When we talk about FMLA and ADA and all the state and local leave laws, this is job protected time. The employees are coming back to work. So, what you're doing to train front end leaders to facilitate that return to work is really, really important. No is not even an option. They're coming back to work. So, employer, lots of responsibilities. And I know one of the things that a lot of employers have been struggling right now is, hey, I got a lot of people working remote, right? A lot of people moved around. So how does this 50 employees in a 75-mile radius, how does that work? Well, the one thing that the Department of Labor, and again, the Department of Labor oversees FMLA, a remote worker's home is not considered a work site. So for anybody saying, oh, great, I got people, they're moving all over the place, so now I don't have to provide them FMLA coverage, that's not true. The Department of Labor has been very, very clear. Your work site is where you're getting assignments from. So you need to make sure that you understand that. You cannot deny someone. So, as an example, I work for the Hartford. I work remotely in Syracuse, New York, right? Maybe there's no one else who works for Syracuse in Syracuse, but you can't use my home as my work site. I take direction from my boss in Hartford, Connecticut, where there's 4,000 employees. Do I meet the 50 within a 75-mile radius rule from Hartford, Connecticut? You bet I do. So employers, use your attorney, understand that, but also understand most states and all of this paid medical and family leave that's going on right now, all that statutory. Anybody who's in New York, New Jersey, you know, right? If they're working in that state, they get coverage. So how states look at it is very, very different than how FMLA looks at it. Another piece that employers need to be thinking about. And then employee responsibilities. And there's not really that many, right? So the first thing is the employee needs to give notice. Do not relieve them of that requirement and adhere to a schedule. If they're going to call in, it's within 24 hours. Hey, it's within 6 hours. That's okay. That's your rule. They have to adhere to it. They need to provide medical. And I hear it all the time. Well, they couldn't, they didn't, it's been over 30. Don't. The law is not giving you very many things that you can do to manage. They have 15 days to provide medical information. They need to do that. Now, yeah, there may be some extraneous circumstance where they really, really can't. And if they can provide you with a reasonable understanding of why, you can review that. But at the end of the day, the goal is 15 days. Intermittent and reduced scheduled leave. This is a big problem for every employer. But most employers, they don't want to rock the boat, right? They don't want to ask any questions. But at the end of the day, the law says, hey, Dina, you're coming to us and saying that you're going to be taking time off every 3 days a week from 3 to 5 to go to your PT for the next 8 weeks. Hey, you know what? Your frontline customer service on the phones, that's really going to impact our business. So how about you change your hours from 9 to 5 to 7 to 3? And then that way you're not impacting our business. And oh, yeah, you don't have to use any FMLA time or PTO to pay that. Okay, no problem. Hey, Dina, that's really going to interrupt us. We're going to move you into another position until you're back at work full time, full duty, because you not being here is going to interrupt our business. These are things that you can do. And employers frequently don't because it's hard, but we want to be thinking about that. And then I keep hitting on this, making those health insurance payments. A little known fact, 50% of first-time new moms will not return to their original employer. So when you and employer say, hey, you can pay us when you get back, and then they don't come back, that just costs you all that money. So making sure that you're doing everything that you can to get that money from the employee up front so that you're not losing that out of pocket, their portion of their medical and health benefits, those are all things that you can and should be doing. It's a lot of work, right? This is a lot. And especially when you're running around trying to do all this other stuff, right? And I know nowhere has quiet quitting and the great retirement and Gen Xers retiring faster than normal. Hey, in the next 5 years, 78 million baby boomers will be retiring in the next 5 years. And a lot of them are in HR. So there's a lot to do and not a lot of people to do it. So those are things to be thinking about when you're like, hey, we need some help because we want to do this right. We've talked about that 15 days and what happens if an employee submits information after that. Well, the one thing with that, if the employee submits medical information late, that first 15 days is always job protected time. Now, you can deny after that 15, but the employee has the right to provide a reasonable explanation for any delay, and you can extend the deadline. But that first 15 days is always there. So it's important. And I know sometimes I come across hard, like stick to it. But remember, like I said in the very beginning, these laws were not enacted to protect the employer in any way. Now, if the employee never provides medical information, fine, it's denied, right? It's denied. But if it comes in late, you are going to need to look at it. You have to look at it, and at least that first 15 days will probably be protected. You can deny after that and say, hey, came in late. But at the end of the day, please remember that there's been a lot of regulatory activity around that. So we want to make sure that we're giving you some good advice there. Some other employer challenges, that medical certification and requirements and the timely tracking, ongoing managing of these things, keeping information private. These are things that employers are facing every single day. Yes, it can be continuous, intermittent, reduced schedule. Continuous is really, really easy, right? Full day increments. But when we start talking about intermittent and reduced schedule, these can extend leave periods significantly. Again, 12 weeks, 480 hours, over 33,000 minutes. If you have 10 people who are out on intermittent leave, you're tracking over 330,000 minutes of time. That's a lot. So anything that you can do. And guess what? Those old spreadsheets and yellow sticky notes and doing true ups at the end of the month, that doesn't work anymore, right? So making sure that you're doing things real time is really important. If you're doing true ups at the end of the month and everyone's like, well, how come Dina got so much time off? Well, because nobody told her, right? Nobody said, hey, you ran out of time because you're doing a true up at the end of the month. These are things to think about. Saving dollars and days and managing that is one of the only things that the employer can do, right? Make sure you're doing it. Understanding your tracking option is also really, really important, right? Because the law allows one of four for FMLA. All the states are doing it differently. So New York rolls back. Massachusetts and Connecticut, they roll forward. California rolls back. But Colorado rolls forward. Well, what does that even mean? Right? And then at the end of the day, if you say, I want to make a change, what do? Well, the law does say you need to designate it, communicate it, and give the employee 60 days written notice it's changing. They don't have to agree. They don't have to agree, but you need to tell them. So, of the four methods, calendar year, every January 1, everybody gets 12 more weeks. Fixed year, if you want to use your fiscal year maybe, and that starts on June 1st, then June 1st, everybody gets 12 more weeks. So not really caring what happened in the past, right? Well, that allows for stacking, right? You got that employee who's been out, they took time off, 10/1 to 12/31, 1/1 happens, boom, guess what? They don't even need to come back to work. They just get 12 more weeks. So they can stack it. Rolling back and rolling forward eliminate that, right? Because you're always looking to see if they've used up time. Now, in the old days, I would say, hey, rolling back is the way to go, right? Because, you're out 10/1 to 12/31, 1/1 you come back to work, 3/1 you're trying to go back out. Well, hey, you look back a year and you say, the HR can say, well, hey, from 10/1 to 12/30, you already used your 12 weeks. You don't have 12 weeks. Okay. So that's good. But I think the main thing to remember is do what's best for you, right? If it's easier to manage calendar year, maybe you're smaller, you don't feel people are taking advantage of that, then use calendar year. It's okay. And also, so do what's best for your organization, but also remember what's going on in the state. So if you're primarily in New York and all your employees are in New York, then roll back because that matches what New York statutory is doing, right? If you're primarily in Colorado and Colorado rolls forward, then roll forward. But just make sure that you're taking the time to assess the method, understanding it, and put an example in, right? Because, yeah, calendar year, fixed year, pretty easy. Rolling back, I think that's easier to understand as well. Rolling forward is kind of hard, right? Because rolling forward is going to look back and it's going to look forward, right? So it's going to look forward first and it's going to say, oh, well, in my example, right, you had that employee, they used 10/1 to 12/31, so they used up 12 weeks right there. And then they're going to go out 3/1. Okay, well, from 3/1 forward, right, rolling forward, they have a clear path to 12 weeks, right? Oh, but wait, that's when you need to look back. And is there any other 12-week period that overlaps with that? Oh, wait, yes, they went out on 10/1. So from that period of 10/1 to 9/30 of the next year, they already used up their 12 weeks. So when you're trying to go back out again on 3/1 of the next year, you don't have any time left. You're not going to earn it back until 9/30. A little more complicated because you're looking back, looking forward. But again, if you're primarily in a state that has statutory coverages and it's rolling forward, you want to match that, right? Makes it a lot easier to understand. Understanding that serious health condition. And I know a lot of times employers are like, yeah, everybody makes it. Okay, that's kind of true, right? If you're eligible and you've got a doctor saying you can't work, we got to go with that, right? It's very, very hard. But you have to understand that there are some requirements, right? A period of incapacity of more than 3 consecutive days involving treatment by a healthcare provider two or more times within a 30-day period, treatment by a healthcare provider at least one time, resulting in continuing treatment, and first visit from both of those items occurring within 7 days. Are we looking at that? Are we assessing that? So those are things, again, when you think about, okay, calendaring, that's a lot. Can we do the tracking real time and provide notices timely? That's a lot. Can we make sure that 15-day time period is managed effectively? And now, do we really understand what a serious health condition and do we feel comfortable in applying our knowledge to make that decision? These are a lot of things, right? And again, especially when you probably only have two people in HR and there's a lot of other stuff going on and keeping it all private. Can't go to lunch and be talking about what's going on with Dina. Can't do that. So you want to make sure that you understand those things. This is right from the Department of Labor website, right? So what does that mean? Well, okay, right out of the gate. Step one, notify your employer. So you need to notify your employer. Don't relieve them of that requirement, right? It may not need to be in writing, it can be verbally, but you need to notify. And if they don't, coverage, right? You don't have to guess. I would say FMLA is very, very don't ask, don't tell, right? So if you don't have to go out there and beg for it, they need to give it to you. Step two, you, employer, must tell them you're eligible right away, right? You can't sit on that for 15 days. Oh, is he, isn't he? That tracking's got to be available immediately. And then if it's not, boom, you need to notify them. So all this needs to happen. Once you receive that notification, within 5 days, you need to tell them they're eligible and send them their employer packet, that rights and responsibilities notification, or immediately deny the claim and say you're not eligible and why. Not just you're not, but hey, you've only been employed here for 6 months. You've only worked 300 hours. Any of those things, right? You need to do that timely. And if you don't, there again, that means you're interfering with their rights. Moving on. Once they provide you that certification, and that needs to be within 15 days, again, you need to immediately determine within 5 days, yes, we agree and we're notifying you, or no, it is not, we are not, this is not a serious health condition. So again, information, you get notification, the employee really only needs to let you know, right? And then everything is on you. Make determinations, send out rights and responsibilities package, get the information back, make sure it's clear, send out the designation. All of that has to happen very, very quickly. So that's where I say this is straight from the Department of Labor site. I think it's very, very valuable to kind of outline for you what the expectation is. And there's a lot of things for the employer to do, right? There's a lot of things for the employer to do. So there's a lot right here. The blue boxes, only three are for the employee. Everything else is for you. It's a lot of responsibility. Those medical certification guides, I just saw this the other day. An employer hand wrote on their diagnosis code. They hand wrote it. Can't do that. Use the form online. Make sure you're not asking for diagnosis information. It's not allowed. You can't really ask the doctor anything. The employer is like, well, why can't we ask the doctor? Because the law says you can't. The only thing you can do is say, did you sign this? Is this your signature? And understand handwriting. We can't understand this. Can you tell us what it is? So employer, your hands are tied, right? If that employee is eligible, and the doctor is saying they can't work, there's very little that can be done. That's why change your focus. What can we do to help you stay at work or return to work as quickly and safely as possible is the best way to be compliant. Can I call them when they're on FMLA? Absolutely, right? You want to make sure you're talking about how can we make sure your emails and voicemails are done? Hey, make sure you got a new supervisor. Can you let me know where this is? We have a new medical vendor. Please go out and take a look at it. The information, I'm going to send you the information for you to review. Hey, you're coming to the end and coming back to work. What can we do to help that? Do you need ADA? But don't ask them to do anything, right? Don't call them too much. That's one thing I think is very, very hard, right? That can be pretty discretionary there, but calling them too much could be seen again as intrusive, and certainly pressuring them to return to work. Those are things you want to remember. So yes, communicate, keep it minimal, document everything, and lead with empathy. How can we help you? That needs to be the ruling thought every single time. And trust me, I hear from a lot of employers, it's not. We don't trust them. We don't believe them. We don't want that. That's not what the law says. Really, how can we help you? Because there's a lot of costs associated with this, right? So it's not just if a lawsuit happens, right? Back pay, front pay, double pay. Employee reinstatement is the number one thing that's going to happen. Attorney fees and court costs, on average, about $78,000, right? You have awards going up to $400,000 or $500,000. And managers can be sued directly and held personally liable. So if you are out there and sharing confidential medical information, and especially in this new world that we live in where, mental illness is a key driver of FMLA. Well, you went out and had lunch with somebody and mentioned that Dina's out on a mental illness claim, and then Dina finds out about it. Guess what? That's not good. So, and then saving dollars and days, right? That lost productivity when they're not at work because you were not managing that, it costs money. And I know a lot of employers, they look at that workflow and they're like, oh my God, I can't do this. I can't get this done in 5 days. I'm just going to approve them. That loss of dollars and days costs a lot of money. And guess what? Just looked at a survey the other day, and they said that the number one thing that employees are struggling with right now is covering for other people, right? There's lots of coverages out there right now, right? If you're in New York State or you're in Colorado or California, people can take off a lot of time. Employees are exhausted covering for the employees who are not at work. Well, when you're letting people who shouldn't even be out, that impacts that, right? So manage the few things that you can manage. Make sure people are at work. Make sure you're helping them to be at work. That needs to be remembered. Few other things. Managing these things with STD and or workers' compensation is great, right? Because short-term disability and workers' compensation, they have significant definitions of disability. We're getting medical in on these people. We can manage it a lot more effectively. Now, yes, the paths might deviate, right? STD might be denied, but the leave claim might live on. That happens, and it happens frequently. But at the end of the day, do everything you can to manage them together so that you really have a better understanding of what's going on. Everybody's only getting one 12-week period, right? So when you're managing that, and I can be out for my own serious health condition, I'm taking care of my sick child, I'm taking care of my sick mom. So, but it is still only one 12-week period. So everybody needs to remember that, and the tracking of that is really, really important. And make sure supervisors, front end leaders, that everybody's getting training, right? What should we be doing? How can we help in this situation so that they're giving the right information and guidance and following up appropriately? Those are really key things. And we hear the Hartford does a future of benefits study every single year. In this year's future of benefits study, it was very, very loud and clear. Employers need training. Employees want training. So, on how these plans work and how their benefits work. So, let's take advantage of that as we move into 26. And we're more than happy to help and partner and do things with our customers to ensure that everybody understands how these programs work and why they're important. Lots of state law activity happening right now. I think that the main thing to remember here is that when we're talking about this, one, there's over 800 pieces of legislation out there right now. We have 24 states that have some form of paid medical and family leave, statutory disability, paid family leave right now, and it's going to continue to grow. But how these programs work is adding complexity, right? So FMLA is only going to cover you for your own serious health condition, you're bonding with a baby or having a baby, and military caring for a covered family member, spouse, child, parent. Well, much of the state leave is going to provide for victims of domestic violence and volunteer firefighters, school activities, civil air patrol. These are things FMLA doesn't cover, right? Hey, FMLA doesn't cover sabbaticals, doesn't really cover bereavement, and or helping at the school. Doesn't. So, how do we do that, right? How do we manage that? And then, because those can be different from FMLA, understanding those types of absences. Leave duration. FMLA is 12 weeks. Well, in New York State, now you can get up to 26 weeks. Massachusetts, 26 weeks. Cali, 52 weeks, right? These are things that you have to understand. With all the addition of all this additional paid medical and family leave, once this is paid time, are people going to take it? You bet they are. So understanding that. And then how you become eligible is very, very different at the state level, right? In New York State, to become eligible for paid family leave, you only need to work for 6 months. In the state of Massachusetts, you only need to work for about 15 weeks and make about $300. So the understanding how people become eligible is important. And just as in the example that we talked about earlier today, right? You have a person, a mom in New York State. She hasn't worked for the employer for a year, but she has worked for them for 6 months. She has her baby. She goes out. She gets covered. She gets 12 weeks of paid family leave and statutory disability. And then guess what? When she hits her year anniversary, she gets FMLA too. It happens. I always say for any employer, if you're in a state that's going to be enacting paid medical and family leave, get those maternity claims in line. Know who was out there and when they had their baby, because they're probably going to be able to get some additional coverage. And then that definition of a family member. When we talk about FMLA, I've been clear: spouse, child, parent. Well, hey, in Colorado, in Maine, in Minnesota, it's literally anyone you feel is related to you legally by blood or not. Well, what does that mean? Well, Dina's in Colorado. She goes out. She's helping her elderly neighbor doesn't have anybody. She's been taking her to her appointments. She uses up 12 weeks of time. Well, then Dina's in an accident. She goes in. She's talking to HR and benefits, and they're like, "Oh, you used up your time. You don't have any more time." And Dina says, "No, I listened to John in his meeting, and John said, my neighbor is not a covered family member for FMLA. So I have my 12 weeks of FMLA available to me." Tracking that and making sure that you understand that and are communicating effectively to employees is really, really important. I always say, when you think about that pyramid of absence and the layering of coverage, no state is a better example than California. So if you're a mom and you're going to have a baby, get to California. So there's at least 6 different leave programs, 7 if you're in San Francisco, over 52 weeks of paid time. So these are things that employers really need to be thinking about, and especially multi-state employers, because every single state is going to be different. And they're also enacting their own leave policies, right? Hey, we want to be the employer of choice. We want to attract and retain talent. So we're also going to do an employer leave plan for parental leave or for caregiver leave. And I would say a takeaway from today's call, everyone, parental leave programs are great. And you all know your employee base better than me. But as I said, 78 million baby boomers are going to be retiring in the next 5 years. 78 million. The average age of the US worker is going to be 42 at the end of that 5 year period. So, yes, parental leave programs are great, but we're definitely going to be seeing a shift, right? We're definitely going to be seeing a shift to caregiver leave being more important to employees like myself, the Gen Xers, who are going to be dealing with older parents. So we want to be thoughtful of that. But the one thing too that I want to make sure everybody realizes: don't call your employer leave policies FMLA. They're not FMLA. So you can call it non-FMLA or not refer to it as FMLA. Everyone does it. Every state does it. But the bottom line is, leave that does not qualify for FMLA but is granted under an employer's leave policy cannot be considered FMLA. They are two separate things. So you want to make sure at the end of the day, you're doing everything that you can when you're building your own policies to make sure everything's classified. Hey, like the woman that we were talking about in the beginning, we don't have FMLA. We have an employer leave policy. We might get FMLA in the future, and that will be in addition to this employer leave policy. So make sure that everybody understands this. FMLA is federal family and medical leave. Federal. So everything else is not that. So good to know. Keep that in mind. A lot of challenges out there. It's complex. We know that. There's a lot of activity happening at the state level. The EEOC and ADA and Pregnant Workers Fairness Act, there's a lot of activity happening there too. So you want to make sure that you know all of that. Managing that intermittent leave time is really, really challenging. Doing the certifications and the recertifications associated with that, making sure things are being done in real time, and then tracking everything, making sure you're documenting everything, making sure you're training everybody. These are a lot of challenges. So absolutely, it's understandable that employers will be looking for help because it's going to continue to grow, right? These are not going to go away. And like I said, things are shifting, right? In the old days, it was all maternity. Well, now it's mental health. Now it's caring for elderly parents. We certainly know that trying to standardize everything and make sure we're using technology more, so important. Again, hearkening back to the Hartford doing a future of benefits study every single year, last year's future of benefits study very, very telling. 84% of employers were like, hey, we want to use more technology. Great. Partnering with vendors who have technology, so important. But at the end of the day, the employee, they still want to talk to somebody. So keeping that balancing act is really, really important. But this is not going to change, right? This is on a fast train, one of those new Acela trains that we're getting in the United States. They're moving 160 miles an hour, right? So that is not going to change, and especially as more and more and more states are going to be jumping on that bandwagon. I know we had a session on ADA. I love Americans with Disabilities Act. Just a couple differences here, right? Because FMLA and ADA are inextricably linked. So, but that couple things to remember, that eligibility for FMLA, we know they've worked 50 or more employees within a 75-mile radius. They've worked for you for a year, 1,250 hours. But guess what? No length of service requirement for ADA. So day one coverage, they can ask for an ADA accommodation whenever they want. FMLA is very clear, 12 weeks for your own serious health condition. ADA, none specified. So it can be unlimited unless the employer can prove an undue hardship. And that job protection. FMLA is very clear, right to restoration to same or equivalent position. But ADA, if at first you don't succeed, try again. So there's a lot out there. ADA has a lot of additional employer requirements and recognizing and making sure you're letting people know and telling them. So linking FMLA and ADA together is important. The Department of Labor that oversees FMLA and the EEOC that oversees ADA, they've signed an agreement in compliance. So they're coming together. They're looking for the same things, documenting everything, making sure it's in your handbook, communicating effectively. But at the end of the day, they are distinct coverages. And with the addition of Pregnant Workers Fairness Act, also overseen by the EEOC, the employer has a lot on their plate. So be thinking, right? Be thinking. Maybe it's time for us to co-source, right? It's not outsourcing because employer, you always have a role, right? Perfecting your HR policies and procedures is so important. That's your role. But removing that administrative burden, consistent, compliant, making sure we're tracking everything real time, making sure we're reducing the potential for abuse, taking that eligibility and managing that more effectively really does reduce exposure. And then also focusing on how can we help you stay at work and return to work as quickly as possible. These are all things that benefit you and they're going to benefit your employees as well. When they feel that everybody's treated consistently and compliantly and people are coming back to work, that helps them too. And especially based on the recent things that I've seen where people are overwhelmed. They're feeling that people are taking advantages of of all of these programs and they're not being at work. And then the folks who are left have to pick up the slack and they're not getting recognized and they're not getting rewarded. These are things that impact. So how can we all be working to limit that impact and get people back into the workplace? So a couple additional sites out there. The DOL site, dol.gov, is great, and the EEOC, eeoc.gov. These are great sites, tons of great information out there. They're posting awards. You can ask them questions. AskJan.org, that's the Job Accommodations Network. If you're not using the Job Accommodations Network, please reach out to them. Totally free, quasi-government agency. They have a ton of great information to help you help employees get back into the workplace. Great industry data at IBI, Integrated Benefit Institute, ibinet.org. And then please come to the Hartford site, www.thehartford.com/PFML, paid family medical leave. all of the information on all the states and all the laws that are out there. There's white pages and podcasts, tons of great information out there. And then if you say, hey, I want to talk to somebody about co-sourcing, please reach out to Corporate Synergies. We partner with them all the time. Great opportunity to be thinking about that strategically as you know the workforce is going to be changing over the next 5 years. This is going to be significant. Now's the time to get ready for that. So, Dina, any questions?
Yes. Kim here. This is a doozy. You ready?
Oh,
This is a good one. An employee gives a month notice to resign with a very clear last day. They get
uh-huh.
hurt, not work related, a week before their last day. They want to rescind resignation, which we do not want to do. Is it okay to cover FMLA until the official last day?
So you need an attorney. This comes up, right? Absolutely. If they are still there, and were they still actively at work? So up to the day that they became disabled. So if they were, you're going to be very, very hard pressed. Absolutely cannot say no for the last week of work, right? But if there was a firm date that had been in agreement, um, I would say, now this is just me, and you need to talk to your attorney. You may be within your rights to say, hey, we had already had an agreement and you cannot rescind that. We are not allowing you to. Your last day of work will be on this date. You're a job protected to that point. Absolutely, but you need to talk to your attorney. There's going to be a couple other things that you're going to need to do there.
Okay, great. And she had one other question. The other is, can we use the federal FMLA form for New Jersey FLA, as New Jersey does not have a separate form for care of a family member, and they accept more parent-child-like relationships than federal?
Yes, you can. So that would never be questioned as long as you're doing it consistently, right? We're asking everyone, right? We're doing this for everyone. So you can absolutely do that. Now, obviously, recognizing those additional relationships is important. The federal form might say something on there, and I haven't looked at it in a long time. But as long as you're clear, we're doing it for everyone. This part of it does not apply. Even sending an addendum out with it would be fine.
Okay, great. Michelle asks, how are domestic partners and their dependents covered under FMLA?
So, the law around domestic partners is a little vague, but the Department of Labor came out several years ago saying we're going to default to whatever the state does. So most states have rules around that. I'm not sure what state that you're in, but if your state recognizes domestic partners and domestic unions, then FMLA is going to recognize it as well. I'm cautioning you all. Remember what I said. Do not look for
What?
ways to deny
What?
coverage. Don't do that.
Oh,
Okay, great. If everybody could just please mute themselves.
help
Thank
them.
you.
Some noodles.
Claudia asks, how would you handle an employee that
I'll put some
requests
beef flavours
FMLA
in
due
there.
to a medical condition that is affecting themselves
And
or a
eggs.
family member and needs to work from home?
I
They're
would make
not
it
asking
bland.
for leave per se, but just to work from home.
Okay, so
Wait, what did David
that's
say? He
that
was.
sounds
Oh,
to me, so that's where you say you've got FMLA and ADA running in tandem with each other, right?
huh?
So that absolutely sounds like an ADA accommodation
I mean, it's
request.
live right now, but
Everyone, we can hear you talking. So that sounds like more an ADA request to me, right? We're asking for an accommodation to stay at work due to a medical condition or mental condition that is impacting me. Obviously, if you can't accommodate that from an ADA perspective, you can say, okay, well, we can't accommodate that if you can't be at work and the medical supports that, right? in that situation, then it can become FMLA where the employee is not working. So, but that definitely demonstrates how they are inextricably linked. Sounds like it's really ADA that you need to look at first. Please be utilizing your attorneys on that one. It's a complicated issue, but if you can't accommodate the work at home request, then that could become FMLA where the employee is out and job protected. The only little piece that I see there that might be a problem is this is a medical condition of someone else, right? So if it's truly someone else, that's not ADA, right? So be careful on that. And that's where I say you need to get the medical information. You need to understand that. You need to be working with your attorney. And then even is that someone else? Um, are they a covered family member? So there's a lot of pieces there. But like I said before, how can we help you stay at work? That's big. So even if it might fall outside the confines of ADA or FMLA, but you still want to help that employee, make sure that everything's documented. We're only going to do it for 8 weeks. This is the information that we need. All of those things are possible too, right? So not, again, let's not be looking for a way to say no. Let's look for a way to apply the coverages that exist. And then if they really don't apply, think outside the box.
Okay. You want to do one more?
Sure.
All right. Juliet asks, we have a corporate office, but everyone is considered remote and we are a virtual company. No one works from the office as their main work site. Where do they get their orders from to see if they are eligible for FMLA? If their manager assigns the work but also works remotely, would we just use the corporate office location?
Yeah. Okay. So again, you're going to need an attorney on that, right? So, like I said, the Department of Labor has been clear. No home is a work site, right? No home. So somebody, even if the boss is receiving direction from the home office, then it's going to be home office, right? I would say the best thing to do is to work with your attorney. And absolutely, if we want to say our work site is our home office and this is where everybody is considered to be receiving, and we're applying this consistently and compliantly to everyone, that probably is best case scenario, right? It's well documented. You can point to it. But the end result of that, of course, is going to be that. You may be giving FMLA to everybody as well, but you're going to need to talk to a good labor attorney on that one because that could be tricky. And especially, again, from a loophole perspective, right? Here's your home office. And like you said, everybody is virtual. Do you have 50 people working within 75 miles of that home office work site? You could probably default to that, but I'm not answering that question, right? I'm giving you the idea. Talk to your attorney. I like the idea of saying, "Hey, we're going to use this, and it applies." That's probably best, the safest scenario. But you can work with your attorney if you'd like to go down a different route on that.
Okay. Thank you, John. Yeah, there were some tricky questions today. Once again, for all of those eligible for Sherman HRCI credits, they will be emailed in the next day or two. As a reminder, this was the last session of our Leave Law Lab webinar series with the Hartford. If you are interested in watching the previous recordings, check out our on-demand webinar library. I'm going to post that in the chat momentarily. Before exiting, we welcome your feedback on today's webinar, so I will also post that in the chat. And thank you for joining us today. We hope you found the session valuable.
Will you be sending the slides out or posting them on the?
Yes.
Okay, perfect. Sorry.
Mhm.
Thanks.
Yep, and the slides too, yes.
Alrighty. Well, thanks for the great session, everybody. Enjoy. Have a nice Labor Day weekend.